welcome to Jamestown Jobs. I'm Emily Bivens with the Jamestown Area Chamber of Commerce, and we're here today at Rock Solid Chiropractic to see what it's like to be a chiropractor. Let's go! Hi, I'm Emily with the Chamber.
Hi, Dr. Stephen with Rock Solid Chiropractic. Today we're going to show you a little bit about what we do with chiropractic and me as a chiropractor. So let's get started.
Let's go.
All right, so Emily, the first thing that we are looking for as we evaluate patients that come into the office is we're going to check to see how their mobility is doing.
Okay.
Chiropractic really makes a big difference in how our mobility is preserved throughout life. So we want to get a baseline with most patients. So we'll have them kind of go through some general movements to see how their body's feeling. And a few things that we're looking for throughout the spine that indicate when we have misalignments in our spine. It's going to be tight muscles, spasms. And generally, as I look at the back here as well, you can kind of see if things are level. You may notice his right shoulder looks like it's a little bit higher on this side. The other thing that we'll do is we'll come down and check the feet too. So if you look straight down on the top of that, which leg looks shorter?
This one.
That's right, yeah. So that right leg is appearing short. I have a lot of people say, like, my chiropractor told me my leg is short. His leg is not actually short. It's more indicating that he has a mild misalignment here on this right side. So it should have a nice bounce to it as I'm pushing. This feels more like a brick. Probably from lots of heavy dock installations here. Johnny helps.
A little bit of lifting, huh? You're supposed to lift with your legs.
Excellent.
But one leg's shorter than the other. Sorry.
We found a few mild restrictions in the movement of his spine, and we are going to remove those restrictions with chiropractic adjustment. So,
Okay.
Johnny, have you just take a deep breath in for me, let it all the way out.
Do you want to
Quite
hold
a
my
bit
hand,
of
Johnny?
Good movement. I'm gonna have you face me on your side here.
Have you ever had anyone start crying? I probably would.
From being scared as well as being tender.
Yeah.
A lot of people, they kind of relate it to the dentist. You don't take care of your teeth, eventually they're going to hurt.
Right.
And so most people come in with a pretty severe cavity. In this case, the lower back can be very tender to adjust, but it's kind of like pulling a splinter out. Sometimes it'll be like, ooh, okay, yeah, great.
Okay.
I feel some good movement in here again.
This is the therapy, you said.
So this is mechanical traction.
Okay.
Oftentimes referred to as decompression. It decompresses the disc spaces, which are the cushion spacers in between the bones.
Yeah.
A lot of times people have a pinched nerve.
So not all chiropractors are trained in this or use stuff like this? This is
All chiropractors should go through basic physical therapies, physiotherapies in school. They have to pass boards saying that they know it. Do they use it or not? It would be different. But I love this therapy, and I think adding additional therapies in with the adjustment can show significant improvement in a patient's condition just a little bit quicker.
So is it just pulling on him? Okay.
So this machine's gonna pull like an accordion, pumping back and forth. So it's kind of like wringing a sponge out underwater. Lots of nutrients are getting flushed through the tissues that have kind of been stagnant, especially if we have spasms where, you can see blood flow really doesn't go through those tissues.
Yeah.
We can get it to relax. We're just kind of squeezing or pumping that disc and really be effective way to deliver nutrients. Oftentimes we'll have patients come in that will show what we call MSR, so muscle, sensory, or reflex issues.
Okay.
They're not symmetrical from side to side, which would indicate a nerve root problem, helping us narrow down what structures we're going to be treating. the spine from the side should look like a banana, have a nice curve like this. You can see a nice continuous line going down the back of the vertebra, and then right here, this shifts backwards. Right, so this is what is causing this patient's neurologic problems, why we looked into this.
Do you receive a lot of referrals, other professionals?
Yep.
And then, or?
It just, no, I'm new here in Jamestown, so I've only been here a year. I don't know very many, but the last 12 years was in Colorado Springs. I worked with 4 different pain management docs that would refer patients.
Right.
They're not great at treating musculoskeletal problems conservatively, and they don't want people on drugs long term. It's not a solution. So if they know and can trust a provider, they're going to send them there, and they'll say, like, I'm going to give a conservative trial. If they're not progressing, I'm going to refer them back.
Right.
If they're getting better, I'm also going to communicate that in a message.
Well, thanks for having us and showing me what it's like to be a chiropractor. So you're looking to hire a chiropractor. What do I need to do if I want to be a chiropractor?
Yeah, so every chiropractic school has a little bit different qualifications. I would assume every state now at this point requires a bachelor's degree and then the chiropractic degree after that. So just like a medical degree, you're gonna have a 4-year period. So, you just sacrifice 8 years of your life and you can love taking care of people's spines too. Yeah, we're definitely looking for help. There's more and more people looking for conservative care as an answer to just long-term health and mobility, but also just treating general pain, musculoskeletal problems as well. So if you were licensed in this state, all you'd have to do is email out resume info@RockSolidChiropractic. I'd give you a call. We can have lunch and talk about what you love doing, what our purpose and mission is, and see if it's a good fit.
Yeah. So getting into that, what sets Rock Solid Chiropractic apart from other chiropractors? What's so great about working here and what the environment that you guys have?
I definitely would say our experience is different for patients. We really do care. We want to see the quality of the lives in this community impacted. We want to see the community impacted through philanthropic giving. We just want to make a difference in what healthcare looks like. That we're truly passionate about. And I think patients can feel the difference in somebody caring. As my children know when I say, it's time for bed, or it's time for bed. I think they feel that we care here as well.
So you mentioned children. You guys treat infants the whole lifespan, right? That's another special thing about Rock Solid.
I was blessed to have my wife allow me to deliver our children. From day one, getting adjusted forward, and I really have just developed a love for that, helping her through pregnancy, adjusting children, fixing skulls that don't want to settle right after a rough labor. Sure. Colic, reflux, just little babies, they're so easy to adjust, and I want more, and my wife said no, so the more infants I can take care of, the better. And yes, our oldest patient, 103, coming in, quick adjustment, doing some decompression as well for her lower back so she could go dance on Wednesdays. It's again, quality of life, but we see the whole spectrum. So
that's really awesome. Well, thanks so much. That was awesome. And I think we're going to go visit with Kayla now out front, right?
Awesome, Emily, it was a pleasure.
Hi, how are you?
I'm good, how are you?
I'm good.
Awesome, my name's Kayla, I'm Dr. Stevens' Chiropractic Assistant here, so why don't you come on back and I'll show you what I do in a normal day. Go in, check what we have for the schedule. Right now we've got a couple of patients here Dr. Steven is working with. I just go through the line. Sometimes they have a certain report that needs to be done or a different kind of intake form that I need, so I get those prepared right away in the morning as well. And then I just go about my day, answering the phones, filing different things. Right now I am currently printing out our health history papers, so we have this intake form for every patient that comes into our office, just so that we can be sure we have all of the correct information for their name, their address, the type of insurance they carry. That is definitely very important in this field to get that insurance information. And then these sheets give us really good information on where they're feeling their pain, what type of medical issues they are relating to at the moment. Take care of them and get them adjusted, and hopefully after a few visits they'll be feeling a lot better than they initially did.
Yeah.
And then when they're leaving, I check them out, take their payment. It's a pretty simple process. I also plan out events for the clinic. Right now we are working on an ice cream social that we will be having on July 12th. So we work on getting the decorations and just the planning of that. We also hold a kids' day once a month, usually the first Monday of the month.
Okay.
And I do all of the ordering and planning for those as well. They're always really fun. We love to have kids in here. It's really fun to get them started right away and kind of, you know, kids are used to getting shots when they go see a doctor, so it's nice to kind of change their mind on that, and you're not always going to get poked or for a bad reason.
Right.
So we really, really love our kids' stays here.
So you're looking to hire another CA.
Yes.
Is the same type of work that you're doing here? Are they involved in the events as well, or?
So the events usually do fall on our practice representative, but we have had kind of in and out with having our practice representative, so I have taken over a lot of that responsibility. We are a huge team here.
Yeah.
We don't really do that whole, oh, that's not my job.
Yeah,
It's a team effort, so even though this is our PR's job, I am always helping, and we do expect that whoever would come in and be another chiropractic assistant
part
would
of
be
the team.
a team player and be willing to help out with those things. Really good qualities that we're looking for in our chiropractic assistants is just being really friendly and outgoing. I mean, we're with people all day long, we're talking to them all day long, and we want to really be that happy face that they get to see every day. And then computer proficiency is definitely a plus. We do most of our work on the computer, so that is a big deal to us. But just as long as you are open-minded, outgoing, and ready to work and to learn, that is what we are looking for in a chiropractic assistant.
And what are the hours? What are you looking for?
So right now, our hours, we only have one doctor. Eventually, once we get another doctor, our hours will change a little bit, but as we are only down to one doctor right now, our hours are limited. Mondays and Wednesdays, we work 9 to 6. Tuesdays and Thursdays, we work 7 to 3:30, and Fridays, we work 7 to 1. So it's about 40 hours a week, give or take a couple minutes here and there. But we would be looking for a full-time position, and hopefully getting somebody hired here soon. We definitely need the help. We are growing amazingly, so we're ready to get some more doctors, some more chiropractic assistants, and grow this business and help our community the best that we can.
Yes, and Dr. Stephen talked a lot about community and your philanthropy and everything. Yeah. So you have those events. What are some other things maybe that Rock Solid Chiropractic does to be involved in the community?
We do donate a lot to the different sports programs that are in town, whether it be the college programs, high school programs, or even private sports clubs. We do donate to quite a bit. We participate in the 5Ks around town. We try to make it to all of the vendor events that we can, just because we know, you got to be here to be a part of the community.
Yes.
You can't be a part of the community and not show up to things. So we do our best to try to get out and do all of the things that we possibly can with the limited amount of time everybody has in a day.
Right.
But we really do love this community here in Jamestown, and it's been a really great year for us in business so far. And
that's awesome.
We're excited for many more great years and growth.
Well, thank you so much, Kayla, for having us to show us what a CA does and what a chiropractor does. So if somebody is ready to apply, wants to work, what do they have to do to reach out to you?
So right now we do have a job posting on Indeed, and then the other way to contact us to apply for the job is just to send your resume to our email. We have 2 different emails that you can send it to. I have either rscjamestown@gmail.com or info@rocksolid.com.
Awesome. Very cool. Well, thanks for having us.
Yes, it was so great to have you here. It was fun having you see what we do for the day.
Absolutely.